The West African sub-region continues to grapple with outbreaks such as Ebola, COVID-19 and most recently Mpox, posing significant public health challenges. The briefing aimed to update the public on the current Mpox situation in the Gambia, as well as the ministry's preventive strategies and response mechanisms. Michael M. Mendy, Director of Health Promotions and Education, disclosed that since the global Mpox outbreak was declared in 2024, the Gambia swiftly activated preventive measures to protect its population. He reaffirmed the government's commitment to maintaining vigilance and ensuring rapid response capacity nationwide.
Since the World Health Organization (WHO) declared the Mpox outbreak in the African continent last August in 2024, in the Democratic Republic of Congo and a growing number of countries in Africa, the Ministry of Health continued to strengthen the emergency preparedness and response strategies. The process continued until when we registered our first Mpox confirmed case in the Gambia here this July. This case, and that is the only case that we have registered so far, and this was due to strong interventions that were carried out.
Meanwhile, Sheikh Omar Bitey, Mpox Incident Manager at the Ministry of Health, provided insights into the nature of the virus, noting that the infection can be transmitted from animals or through close human contact. He explained that the ministry continues to monitor and contain any potential spread through early detection and coordinated action.
You can get it by, if an animal actually who is infected with the virus actually bites you, or you have some scratches or whatsoever with that animal, you can actually get it through that. You can also get it through eating of meat that is actually contaminated with the virus itself, or the animal that you have killed has Mpox, then you eat that animal, it means that you can also get it through that. So that's the way you get it from animals. Now, but once it actually comes into human, what happens is like you get it through contact specifically. Contact like mother and a child, you know, because the mother is always having the child. If the mother has it, it means that the mother can actually give it to the child. So that's one of the ways that you can actually get it.
Mr. Bitey further explained that certain groups, such as toddlers, pregnant women, and sex workers, are particularly vulnerable to infection due to compromised or underdeveloped immune systems.
Because of the immune system, they actually are at risk of getting Mpox. And when they get Mpox, it's also worst. Children, pregnant women, people with HIV, who have HIV, because of their immunity goes down, they are also at risk of actually getting Mpox, okay? And healthcare workers are also at risk of getting Mpox. And sex workers, people with multiple partners, because you're having sexual relationship with multiple people, you're also at risk of actually getting Mpox. So these people are at higher risk. Everybody is at risk, but these people are at higher risk of actually getting it.
He noted that one of the key interventions implemented was the National Response Plan, which outlines comprehensive strategies for surveillance, public awareness, and case management.
Yes, centrally we have activated the national response, but we have to activate the regional responses also. And when we went around, that was what we did. We went to the different regions and activate the regional response in all those regions. And also find out what they have and what they didn't have to make sure that those things are provided as much as possible. And equally, to identify places specifically for isolation, you know, and because this is very important, because when you have a patient, we need to know what should we do, where should we take the patient, who is a suspected case. And once the patient is actually tested, the patient is actually negative, or the patient is positive, what should we do further?
According to the ministry, the Gambia has so far recorded only one Mpox case since the outbreak, thanks to the early preventive actions and cross-sectoral collaboration. Health officials continue to identify challenges and address them promptly to maintain the country's strong disease surveillance and response capacity. Lamin Ba, Star TV News.